Hello, thank you very, very much for joining me this afternoon. As you can see, I've sort of slightly Christmassified myself for this presentation. Hope you're all doing well, and obviously hope you have a lovely break in the Christmas period, which is upcoming after this very, very challenging year indeed. I thought it would be interesting to share with you some data that you have contributed to. So any of you that are followers of vet professionals will know that we do quite a lot of owner surveys. We do some vet and vet nurse surveys as well, but we have in particular done a number of cat owner surveys over the year. And these are studies that have been published, I'm delighted to say, for the most part in really high quality feline journals. So there is information actually on the website. If you look under the survey tab, you can see survey results, and there's a little snapshot of the most recently published papers that we have. But because we've been talking about diabetes recently, I thought it'd be interesting to share with you the results of an owner survey, which you may well have participated in, and also in the context of recent discussions, really, I think helps to complete the picture of diabetes and cats and what we know at the moment. So that's the plan for this session. Before I deliver the owner survey results, I was just going to very briefly remind about some of the key points about diabetes in case you were not able to attend some of the previous sessions. We'll then focus on the owner survey results, and then after that we can have some time for discussion Q&A, which can include diabetes, but of course other topics absolutely fine as well. And I would like to really take this opportunity to say a big, big thank you for your support, not only of the surveys, but also of the cat cafes. It's been really appreciated, and it's been a tough year for everyone. So thank you very much for your continued support of vet professionals. So let's briefly just remind ourselves about diabetes and why this is, firstly, why this is such an important disease for us to know about, and how often it is seen in our cats, and also how we might recognize it as a carer. So it is quite a common disease in cats. You will all know something about diabetes because it's a disease talked about a lot with respect to our own health. In the cat world, it is not the most common hormonal disease that cats get. The most common endocrinopathy, which is our sort of posh word for hormonal diseases, is actually hypothyroidism, which affects about 10% of older cats. Diabetes, as you can see from this slide, estimated to affect a smaller proportion of cats. So about half a percent of our patients, 1 in 200 cats, is the approximate frequency of diagnosis. And actually lots of similarities in the most common form of diabetes that cats suffer from. There are different types of diabetes that we can classify our patients into, and that's exactly the same as in human medicine as well. So we have type 1, type 2, type 3, and actually the most common form of diabetes that we see in cats is type 2 diabetes, which is also very common in people. And in all forms of diabetes, the main problem is that either there is not enough insulin, or that the insulin that's produced is not able to work properly because of this phenomenon called insulin resistance, where the cells of the body just aren't responding to insulin. And insulin is really important because it allows glucose to move into the cells. So if insulin is not there, then it's difficult for glucose to get into the cells. Glucose, sugar, is an energy fuel. So if it can't go into the cells have to find alternative energy sources. And then that high blood glucose, that high blood sugar, because it's not going into the cells, causes all sorts of problems, including very commonly the increased thirst that we see in our patients. So often diabetic cats drink maybe half a litre of water a day. They are incredibly thirsty. And type 2 diabetes, this combination of reduced insulin production and insulin resistance, is the most common form. So that affects about 80% of our diabetic cats. And the typical characteristics of our diabetic cats are often that they are middle-aged or older. Male cats are overrepresented, and often overweight and sedentary cats are overrepresented as well. So as with ourselves, if we gain weight, that can lead to insulin resistance, and that can lead on to either cause or increase the risk of diabetes from developing. So all of these factors are important in increasing the risk of diabetes, but there are other factors as well. So you can see some medications like steroid medications can increase the risk for diabetes. Also, some breeds have a higher predisposition, and Burmese cats we've known for a long time, there are certain lines that are particularly vulnerable to becoming diabetic. So if you have a Burmese cat, you definitely want to keep their weight under control. More recently, Tonkinese Norwegian forest cats are also on that list of at-risk breeds. And if your cat does develop diabetes, then often you will notice a number of really common clinical signs, which include typically weight loss, in spite of often a normal or even increased appetite. So a lot of diabetic cats will be having a very, what might be described as a healthy appetite. They will be eating all their food and perhaps asking for more food. Some cats are incredibly hungry, but will be losing weight. And in combination with that, very commonly as well, this increased thirst and increased volume of urine produced. And the reason for this is that high blood sugar, when it reaches the kidneys, that sugar will spill over into the urine, and it takes water with it. Wherever glucose goes, it takes water with it. So you have lots of sugary urine produced, which also increases your cat's risk of a bacterial urinary tract infection, for example. But because it's taking all that water with it, that means the cat is not only producing a large volume of urine, but then it has to drink an awful lot to stop itself from becoming dehydrated. And you might, in extreme cases, see your cat doing something which would previously be very abnormal for it. So, for example, drinking tea from a mug on the table. The cat's so thirsty that it's actually going to drink some tea. Or this cat is actually in the clinic and there's a jug of water. This is in the X-ray room, and the cat just headed over and started drinking, which clearly is not normal. That demonstrates we've got very, very severe thirst present. If your cat uses a litter box, you might spot that there are more urinations per day or larger urinations when passed. And this is another reason I like clumping cat litters, because you can see what your cat is doing. And you can see, oh my goodness, these clumps are getting larger and larger, or there's more of them in the day. It can really alert you to this sort of problem. Diagnosis of diabetes, well, the key things are that high blood sugar and presence of sugar in the urine sample, but there are lots of other things that go into also raising our suspicions of this condition, and that starts with the history. So what you tell us about your cat at home, for example, that increased thirst and ravenous appetite and losing weight. We may also see some other clues when we examine the cat. So often there will be a slightly pot-bellied appearance. There can be muscle loss because the muscle has had to be used as an energy source, and that can make or be one factor that contributes to this slightly pot-bellied appearance. But also sometimes the liver can be enlarged, and that can contribute to that as well. Some cats with long-standing diabetes will have problems with the nerves to their front and back legs, which can mean they walk with a more sunken stance, and the posh words for those are palmagrade on the front legs and plantigrade on the back legs, so where the leg is just much more sunken down to the ground. And we confirm the diagnosis, as I've mentioned, using our blood and urine tests. And there sometimes are some complications here, because in cats, stress can also affect blood sugar levels. So that's the main thing to really alert you to, that a high blood sugar level on its own is not diagnostic of diabetes, because of this so-called stress hyperglycemia, stress causing an increase in blood sugar. But if we do have a high blood glucose and glucose in the urine, it makes it very likely that our cat is diabetic. And if we ever find ketones in the urine, which are an alternative energy source that diabetic cats will sometimes use, then that also confirms the diagnosis. And there are sometimes some additional tests, as I've mentioned here. Fructosamine is one that we often use as well when assessing and monitoring our patients. From a management perspective, the best approach to treatment is a combination of things. So that includes, if there is a known cause to the diabetes or a known exacerbating factor that we can correct, then obviously we do our best to correct that. So if that is that our cat's overweight, then weight loss certainly helps. If there are certain medications that have perhaps precipitated the diabetes and we can withdraw those, then that's great. And sometimes there are other illnesses that can cause diabetes that we can manage. That's so-called type 3 diabetes. But for other cats, for our type 2 diabetic cats, then the mainstay of therapy is a change of diet to a therapeutic diabetic diet, which is typically very low in carbohydrate, so low in sugar, and also combine that with insulin. So we're giving some extra insulin to help that body to process blood glucose more normally. And in some cases, we can get what's called diabetic remission, which is where the diabetes does disappear. And often it will return at a later date, but we can get to a situation where the cat is not needing insulin, which is, of course, wonderful when that does happen. The therapeutic diets, as I've mentioned, the main characteristics are that they're low in carbohydrate, and often it's preferred if you use a wet diet for your diabetic cat, and that's partly because they do have an increased fluid requirement, and because they tend to be older cats, we want to support their hydration, but also because it's quite hard to make a very low carbohydrate dry food, because just to keep that dry kibble together, I'm told that the processing requires a certain amount of carbohydrates. So it's actually quite challenging for the specialist food companies to produce dry diabetic diets that have as low a carbohydrate as is considered currently ideal. And there are other additives to the ideal diabetic diet, or that are based on our current understanding that we hope will help with glycemic control, so blood glucose control, and also maintaining a healthy weight. So that includes things like L-carnitine and antioxidants, for example. But many of our patients will need insulin long term, and in the UK, these are the current authorised veterinary insulins. So we have CAN insulin, which is a intermediate acting insulin, and that's available in these little bottles. And we would then use a separate insulin syringe and needle to load up our dose of treatment. But it also is available in what's called the vet pen, which is an insulin pen. You may have seen some of these with people as well, sometimes use insulin pens, and they can be helpful for cats that need very low doses because they're very accurate at doing, for example, just 1 unit of insulin, and also sometimes for people who find it difficult to handle a syringe, for example, if you have arthritis and it's quite fiddly loading up a normal syringe. And the other insulin we have available, more recently available, is a longer acting insulin, which is generally the first choice actually for cats, again twice a day, and this is called Prozinc. So let's now look at the owner survey and see what we found. And I think the key thing really to say is that, to my knowledge, there are not many, if any, other large owner surveys of owner experiences of looking after a diabetic cat. So I'm really delighted that we were able to collate data actually from 2 surveys that we ran as student projects, so as vet student projects. I work very closely with the University of Edinburgh Vet School, and Professor Gunmore, Danielle Gunmore, who's probably a familiar name to you, is the head of the feline department there, and we run a lot of studies together, often starting off as student projects and then growing into bigger things at times. And this paper, which was published last year in the Journal of Feline Medicine and Surgery, which is, I think, the ideal publication for these sort of studies, was actually written up by one of Danielle's students who was doing a postgraduate training, so qualified vet, but doing her postgraduate training, and she won an award for this paper. So it really was extremely well received. And the paper summarized results from 2 studies where in total we had more than 800 questionnaires to analyse. And once we'd done a little bit of cleaning up, so removing some duplicates and some incomplete surveys, we had nearly 750 useful questionnaires, so 748 owner perspectives represented in these surveys. And respondents to this study lived around the world, but primarily UK and US. So 43% from America, 36% UK. Canada and the Netherlands were the next largest represented countries, and then there were many other countries with smaller numbers of participants. So, as I was saying earlier on, male cats and male neutered cats in particular are often overrepresented when it comes to diabetes. And lo and behold, we can see, oh, wow, there's a real skew of the data here. 412 of the cats that were being reported in these studies were male neutered cats, 210 female neutered, and we had a smaller number of entire male and entire female cats. So very much in keeping with our understanding of cats at risk of this condition. Most of these cats had diabetes for quite some time, which was great. So very experienced owners with quite detailed experience that were able to tell us about their experience. And at the time of survey submission, 676 of the cats were alive. So some of the data was from cats that had recently died, but mostly was from cats still living. And in fact, nearly 20% of the cats represented were in diabetic remission. This situation where diabetes is diagnosed, it's treated, and it sort of goes into hiding, if you like. It sort of disappears. So these cats no longer needed insulin therapy. Many of these cats will have remained probably on a therapeutic diabetic diet, because that's also a diet which is suitable for a healthy cat. But they didn't need additional treatment, which is great. So we asked all sorts of questions, including what was discussed with the owners at the time of diagnosis, so what their awareness was of different features of diabetes in terms of management in particular. And you can see that the most frequently discussed topic, no surprise really, was insulin. So this is the bottom of this chart here, but you can see not quite 100% of the owners, but certainly more than 90% of the owners, insulin was very much discussed with them. But we also had other key discussions involved what checkups might be needed, dietary recommendations as well. And then you can see other things that we asked, did they have discussions on, where we had a smaller proportion of owners that were aware of perhaps these discussions. So for example, hypoglycemic drugs was the least discussed, but actually to me that's perfectly fine, because any of you that tuned into the last session we did on diabetes where we talked about treatments will know that my verdict on hypoglycemic drugs, these are drugs that are intended to lower blood sugar, and so as an alternative to insulin to treat the diabetes, but sadly they don't often work very well. So I would personally not probably talk about them very often unless there was a discussion of what are the alternatives to insulin. That would be the time I would probably bring that up, because as you will imagine, at the time of diagnosis, there's a lot to talk about anyway. So that's probably one of the lowest priority topics from my perspective. So I think it's correct that it's up here. We also asked, well, when it came to treatment decision making, what was most important? And the wonderful thing really about all of you that do participate in the online research is that really, without a shadow of a doubt, you are the carer that I would want to have if I were a cat, because pretty much everyone in this survey, and we've had this in other surveys as well, selected the most important thing really was what was best for their cats. That was, you know, the number one aim. But the vet recommendation, clearly very important. So 86% of people selected that. Less important were things like the ease of treatment and fear of giving injections. So although those certainly were important to some people, overall a lower importance to these. Concerns at the time of diagnosis, understandably, primarily revolved around, well, how expensive is this treatment going to cost in terms of the long term? Because you don't want to start a treatment that's you can't continue to support fully. And then also a big concern with carers was how do I cope with if I'm away from home, which is probably has been less of an issue, I'm guessing, during 2020, because we all have been quite homebound, as it were. But in our normal lives, often it's normal for people to have to travel with work and obviously want to go on holiday from time to time as well. This next slide has got a lot of words on it, but I will talk you through it. But essentially what it does is summarize what carers thought at the time of diagnosis or just before treatment was started, and also what they were now thinking or how they would now answer this question. So in a way, it shows, well, what was worrying more people at the start, and are they still worried about these things? So for example, we've got here at the top, before treatment, I thought I would find it difficult to arrange for someone to take care of my cat when I'm traveling or away. And 77% of owners were really worried about this. After treatment, 55% worried. So it's still obviously an issue for more than half of owners, what to do when they're away, how to manage it. But perhaps for certainly some of those owners, maybe a quarter of the owners, it was never a concern. A quarter of the owners, it's now no longer a concern because they found a way of managing that. And this study was obviously done way before COVID. So it's in sort of normal times, if you like. What about the costs of treating diabetes? Well, 69% were worried that the costs were high. After treatment, fewer. So still 50% of them have found the costs high. And certainly this is an illness where there's a lot of monitoring required. And so it's not, unfortunately, a situation where you can just, for example, give an injection, off you go, that's it, see you in 6 months. It is quite an intensive thing to manage. So cost is definitely an issue. Some people, 41% of owners, in fact, were worried before treatment that treating their cat daily would interfere with their daily life and take too much time. But that dropped quite dramatically to 22% after treatment. So just a fifth of people really finding that it's quite time consuming and difficult for them. And then lastly, we had, before treatment, I was worried my cat's treatment would negatively impact my relationship with him or her. 40% of people agreed with that statement, but that very much reduced after treatment. So just 17% of owners that felt that the cat's treatment had negatively impacted on their relationship with their cat. And I guess that may be something that where, for example, a cat that's been difficult to stabilize and has perhaps needed a lot of veterinary interventions, a lot of checkups, where perhaps that might have impacted on things from the owner's perspective. How were the cats treated? Well, again, not surprising really. Most of the cats received insulin, 93% of the cats, and most of them had insulin twice daily, which is the most frequently recommended protocol. We had about a third of the cats receiving a therapeutic diet that was what we in this paper call prescription diet. So that is specially formulated by the diet companies and aimed at cats with diabetes. A smaller but quite significant proportion of cats were receiving a low carbohydrate diet that perhaps their owner had sourced. So some of the initial studies for diabetic cat stabilization actually used kitten food, and that may have been what these people were using, which is generally a lower carbohydrate, higher protein diet. But they had essentially sourced that and made that decision themselves. Very small number of cats receiving either food supplements or oral hypoglycemic drugs, which again does not surprise me because really the best response typically is with insulin and diet. 90% of owners were using a needle and syringe to administer the insulin, and about 10% had experience with an insulin pen, which was not always the vet pen that we have in the UK, but because this was an international survey, some owners were using human insulin pens. So, for example, Glargine pens. And we also asked how difficult they had found it to, using an insulin syringe, load up the correct dose of insulin for their cat. This chart shows the difficulty ratings that owners gave when they did it for the first time, which is shown in yellow, compared to the most recent occasion, shown in blue. And what you can see is that actually, more than half of the owners said that it wasn't difficult the first time, so they weren't really too put off by this, although you can see that the most recent occasion, it definitely about 90+% are saying not at all difficult, and a smaller proportion of people either finding it varying degrees of difficulty at the start, but then things seem to very much improve. So no one finding this very difficult. I guess those people that were finding it difficult, again, maybe that related to the dose of the cat, the dose of insulin the cat was receiving. If it's a very little dose, it can be quite tricky. And also if you do have, yes, arthritis or any other issues which affect your ability to handle a needle and syringe. We also asked similarly about how difficult it was to actually administer the insulin. So this is giving the injection. This is something that you can see a big change for. So again, the most recent occasion shown in blue, more than 90% of owners said not difficult at all. Absolutely have completely sussed this technique. But you can see that at the start, maybe nearly 20% of people said it very difficult. This was something that I think a lot of people, certainly when you explain to them their cat's condition and talk about insulin injections, it can seem really daunting. And certainly many owners at the start would certainly have described this as, off-putting, I think at the very least. We also asked about needle injuries related to handling diabetic cats and giving them their insulin. And actually 41% of owners had at least one injury. Fortunately, for almost all, it was just on one occasion, which again, I think is perhaps not too surprising, but we don't want people having injuries at all where at all possible. The injuries were mainly with the insulin needle. So the needle on the insulin syringe is attached to the syringe. It's not a detachable needle. But very occasionally people were injuring themselves when collecting blood glucose, doing home blood glucose monitoring, which I'll talk about in just one moment. How were the cats being monitored by their carers? Well, bottom line is extremely well, but a number of different techniques that were being used. So most commonly used were first, how much the cat's drinking, which I would always advocate monitoring in a diabetic cat where possible. I find that incredibly helpful. Also the general demeanor of the cat, because if the cat is feeling unwell, that potentially is an indication of diabetic ketosis, which is an emergency situation, a potentially life-threatening situation. So we want to keep an eye on that. And similarly, appetite is useful to monitor from that perspective. Body weight, very helpful. A lot of owners monitoring body weight in their cat at home, which is absolutely brilliant. HBGM is home blood glucose monitoring. And in our survey, that was nearly 80% of the owners were doing this, which is a really astonishingly high figure, which really reflects the high caliber of carers who participate in our surveys. I think if you did a poll of UK diabetic cat owners that were, you met in the street, you would not find nearly 80% of them doing this. So it's skewed by our wonderfully biased, extremely dedicated participants in this survey. Some people monitoring amount of urine passed in the day, and some monitoring urine glucose, which tends to be less helpful in terms of monitoring our patients overall in terms of their insulin requirements, but it's really helpful for spotting diabetic remission where the diabetes has sort of got better. And for those people that were doing this home blood glucose monitoring, actually quite a lot of them, and again, this is a reflection of how dedicated the people that tend to do our surveys, were doing this actually quite frequently. We tapped into some diabetic cat owner social media groups, and people in these groups very kindly participate. You can see they really are super dedicated, doing at least one home blood glucose test a day in their cats, but other people doing it less frequently. And I think there's not necessarily a protocol that I would force upon you if you do have a diabetic cat and want to monitor it. But if you do have a diabetic cat and are interested in home blood glucose monitoring, then this video, which is one of the International Cat Care, iCat Care videos you can find on YouTube if you search home blood glucose testing for your cat, is a really nice video that shows the technique. And the wonderful thing is that nowadays we have these really brilliant glucometers that will measure glucose in the tiniest amount of blood. So, I mean, in fact, this droplet of blood on this picture, which looks quite a large droplet of blood, you could do, I don't know how many, 20 blood glucose tests at least on using a modern glucometer. They really just need a tiny bit of blood, which is great for us. What else did we find? Well, we certainly found some room for improvement in terms of clinician discussions with carers, because there were some things that I think we felt were quite important that all carers should really have awareness and knowledge about. For example, how to recognize a cat whose diabetes is unstable, how to recognize a cat that is in diabetic remission, how to recognize hypoglycemia, low blood glucose, and we found that less than half of carers had received information on these really key topics. So there is room for improvement, although it's a huge topic to discuss in the vet clinics. So I don't want to appear too critical of the vet clinics. There's certainly an awful lot of ground to cover. In this survey, there was quite a strong thread, actually, that many carers felt that dietary management of diabetes wasn't as thoroughly discussed with them as they would have liked. And that may be partly as well because there still are some controversies as to what is the ideal carbohydrate content of the diet, what is the ideal dietary regime. So that may be why it's harder to have that sort of clear-cut discussion. Many of the people that participated in this study had done significant amounts of online research themselves. So 76% of carers had found online resources themselves, which they found incredibly helpful. And I guess the only shame here is that, again, it would be nice if vet clinics were perhaps a bit more aware of where to send cat owners to for information on diabetes that would provide them with the sort of high quality reputable advice that you would want your carers to know about, rather than perhaps other advice that might not be as good. So in summary, I think the insight from this hundreds of carers of diabetic cats has been really helpful in outlining to us as clinicians, well, what really matters to a carer, what are the key priorities, what are the key concerns. And clearly key concerns include the cost of treatment, how to manage being away from your cat with work or holidays, and how to overcome that initial difficulties with loading up your insulin syringe and giving injections. So it's helped us to understand really how better we can support carers. But also we've learned a lot more from these owners in terms of their perspective. For example, the dietary comments that I just mentioned to you, perhaps we need to do more to support carers with dietary recommendations. We could see also that nearly 20% of the cats in this study were in diabetic remission, which is really good sort of figure to be able to say to people. It's obviously not an unbiased population, so it's difficult to say that is the frequency with which we might expect diabetic remission. Nonetheless, it's still, I think, really useful information to hear. And of course, you can see through this survey that there are a lot of fabulous carers out there who are doing a huge amount to support their cats and helping these cats to do so well. So cats very, very lucky with that. So in terms of further resources, I would say iCatCare, International Cat Care do have some good resources on diabetes. Also, if you really want to read up on this topic, then the veterinary division of International Cat Care, which is called ISFM, the International Society for Feline Medicine, they have written some guidelines on management of diabetes in cats. And those consensus guidelines are free to download. So if you just Googled ISFM consensus diabetes, for example, you would find them. And whilst they're written for vets and other veterinary professionals, vet nurses, if you have an interest in diabetes, I think you could still get a lot out of those. Beyond that, of course, on my website, there are some other useful resources which still fit in with the diabetes theme. So, for example, you're perhaps more fragile diabetic that needs support to maintain its hydration. There we have some information in the free download section on how to support hydration in cats that you might find interesting. And of course, you're welcome to contact for further advice and support as need be. And finally, before I open the floor for any sort of question or discussions, just that usual reminder about surveys. We've actually got a new one since I last came on a cat cafe, which is to do with coughing cats. So if you have a cat that has a chronic cough, so this is a cough that's persisted for typically several months or longer, for example, due to asthma or bronchitis, we would really love to hear from you on how you have managed that cough and how it has worked for your cat, and whether you've had difficulties with any of the treatments that have been administered. And there is a link to that on the survey page of the website. So also, if you have any friends or family that you know are looking after cats with a cough, we would really love their participation in that. We still have also our survey of squinty cats, cats with strabismus and nystagmus, the flickery eyes, particularly the Burmese linked breeds. But there is a whole list of other breeds on that survey page that we're interested in your perspective about whether or not they have a squint or nystagmus. And thank you again for participating in the other surveys, and for your wonderful support, which is very definitely appreciated. So on that note, I will stop speaking, at least for a moment, and happily see if there's any questions in the chat box, or take any discussion from you. Feel free to unmute yourself. Thank you very much.